neurosurgical team goes ahead as planned. So there are alternatives we are thinking about. Meanwhile, we are hoping that before the end of this week, we get the elevators back working. It has to do with purchasing parts and as well as having one or two of them repaired. So I thought it was to extend our sincere apologies to you all for that. But for those of you who have registered to come for the upcoming surgical outreach at the hospital, we want to say that we'll still execute that plan alongside with our colleagues that are coming from Canada and other parts of the world for this coming for this all important excited neurosurgical outreach. Basically thought it wise to extend our apology to our patients and relatives for the unfortunate event of the elevators being down for the past 2 weeks.
Okay. All right. So, you know, CEO, you have a very special kind of leadership, and your leadership at the John F. Kennedy Medical Center is one that the employees and the staff there really appreciate, and because you always have that kind of spirit of putting yourself in the situation of the patients and the patient's relatives that go there, and this is why you have thought it wise to apologize, on behalf of the medical center because of some of the constraints that some of our patients, our clients have there. So thank you very much for that. So we move to the next that had to do with a question about some of the activities that have been obtaining in the recent weeks, and which you have come today purposely to talk about them. And so a few weeks ago, the United Nations, European Union, through the ambassadors, donated some forensic equipment to the John F. Kennedy Medical Center. Let's say the pathology laboratory, because that pathology laboratory, when you came, upon taking office, you managed to have, through the government of Liberia, you managed to have done some renovations, and out of that, you equipped it, and so the partners have seen your effort and they have come to help. So the European Union, all the delegation were there, to do the official turning over of these machines and all of that. What does that really mean for the medical center, Dr. Brown?
Thank you, Creighton. This is a very big boost for the institution and again the country as a whole, in that there were several pathology equipment that were donated by the United Nations to the John F. Kennedy Medical Center to beef up our capacity to provide again appropriate care and be able to conduct autopsy in the most secure manner and then also ensure that our patients are cared for appropriately. There were many things brought in, and among them were freezer, where our morgue is now going to have a brand new freezer that have several compartments to take up to 15 or more bodies. Right now, if you went to the morgue, you will realize that that section is now being modernized as a result of this donation from the UNDP, and as well as effort from the Ministry of Justice as well, because the Ministry of Justice was very, very instrumental as well in working along with JFK to ensure that this happened. Because if our pathology department become more functional, it's also going to help the Ministry of Justice in executing some of the cases that they have on their book. So if you went to the morgue between now to perhaps the middle of this month, you're going to have a more modern storage capacity for bodies that we're now going to have at the hospital, meaning be able to preserve body for a longer period of time before relatives come to get it away. But let us not forget it's going to be used primarily for bodies brought in by the Ministry of Justice, especially those that require investigations. Okay.
The ones that you talk about conducting autopsy,
especially criminal-related cases.
Okay.
Yes, to ensure that those bodies are cared for appropriately, so that when they are dead, when the Ministry of Justice wants to conduct autopsy, the body will be in a more ideal condition, so that you'll be able to gather the facts relating to the crime. And they also came in with dissecting tables, which are now being installed in the morgue as well. Sorry, Dr. Pade, we have known the detail on
the pathologist,
on the other things that were brought in, but it was not intended to be only at JFK. There are other equipment that are to be stationed in other parts of the country as well, but all geared toward helping the forensic department to be able to aid the Ministry of Justice in making appropriate diagnosis.
Okay. So, we also are concerned about the capacity. What is our capacity at the John F. Kennedy Medical Center to operate these equipment? One, in terms of staffing, and also the space, because the last time we had a program there where the official turning over of these equipment, you took a tour with the team where you are showing them some of the spots and things that they can be able to develop in order to have some of these equipment kept there, because those are very huge equipment that need space. And also, so how about that?
Well, thank you, Creighton. Most often, one would never have adequate space to accommodate partners as they come in, but as they come to help, one of the things we often do is to think outside the box and see how best we can create an environment where we can have an amicable working relationship. So after those things were brought in, we identify a site that JFK, partnershiping with the UNDP has now constructed a platform using internal revenue that we generated to have those platforms fixed. Because although it's intended to help or upgrade our capacity to come up with forensic diagnosis, but it's also going to help the institution in terms of preserving our bodies. Okay, so we often work with our partner to see how we can get things going as much as possible. The issue of the manpower, we definitely have two pathologists that are there that definitely are definitely competent to execute the tasks.
And they were even trained by the very same Americans.
They were sent out by UNDP sponsor and they've returned. And besides, there are other staff within the pathology department that are working along with them. In instances where there will be the need for recruitment, we definitely going to see how best we can do that. But for the time being, definitely we have the manpower to attend to whatever form of autopsy that may come out after installation. However, the UNDP did brought in someone to do the formal installation of some of the equipment that are going to be used at the JFK site.
All right. So we're talking about partners and partnership and all of that at the John F. Kennedy Medical Center. You have been having to impress some of the partners, and they are coming around to help make JFK the hospital of choice that we have there in our slogan at the medical center. And so of recent, we also saw a team from the UC also visited the medical center on an assessment of the sanitary condition of the medical center. You took them on that tour. And so how does the medical center tend to benefit from this other partnership also?
Thank you again, Creighton. Our partnership with UC dates back as far as 2019, I would say, for this administration, since we started having a more cordial relationship with the United States Agency for International Development, and it started from the previous ambassador, and now he has extended to the current ambassador as well. UCA has been of great help when it comes to looking into helping us in terms of having a medical record or electronic medical record system set up.
Okay.
They're also interested in helping us with manpower development, and also helping us with water and sanitation projects. So they brought in an expert who visited our facility to look at how our sanitation and how we're caring for waste is like, and to see how they can advise us to ensure that we appropriately took care of our waste. Just having brief discussions with the consultant who came, just realized that there are a couple of things we're doing and never knew was wrong until he began to make mention of some of them, and I said, wow. So having this consultant around periodically and having frank discussions with them on what you're doing, it's all about improving services and improving the care we intend to provide for our people, and to ensure that we have a safe working environment also for the staff and people we have on campus. If you go on campus now, there's now a significant improvement in our waste disposal, and there is one area where they are very keen on helping us to do, especially when it comes to medical waste. And so they're having discussions around that, and the team from UC together with the team from JFK are going to have periodic discussions on the way forward. And as we improve on each of those points that I made mention of, we'll also come to inform the public about where we're going and what the challenges are. But in short, there have been a very good cordial relationship between USAID and JFK.
Okay. Thank you very much, Dr. Brown. That was the voice of the Chief Executive Officer and General Administrator of the John F. Kennedy Medical Center. We are discussing some key administrative achievements and other issues at the John F. Kennedy Medical Center on the program today inside JFK. And if you are just joining us, I want to say welcome to the program. And this is the discussion. We have Dr. Jerry Brown, he is the head of the JFK, and also we have Dr. Alberta Clark-Colley. She is the newly elected president of the Liberia Liberia Dental and Medical and Dental Association. And she is also here speaking of some of the initiatives that will characterize the official inauguration program of her leadership and all of that. So we'll go back to her quickly, and then before we come back to the CEO again, she's going to jump in with some other later development, what she intends to do. If she is, let's say, calling on for some help and all of that, she's going to tell you to say this thing to the public. Then when we come back, we're going to call the numbers also. So, Dr. Clark, please jump in quickly.
Thank you very much, Creighton. So, the Liberia Medical and Dental Association caters to the entire doctors and dental community. We cater to them, their welfare and everything. And so presently we don't have like a building or a meeting place where we have some very important seminars, we have workshops, we have other doctors coming up from other countries to come and meet us and to have discussions. We don't have a place where we say this is like the LMDA's office that we can meet at. So that is one of the most important things that we would like to do. We'd like to have an event hall or something that we can be able to meet at and have these discussions, because as we go in other countries, we get taken to their places. Exactly. And so we would like to take people to our place. Yes, and say this is what we have. And we're also supposed to make sure that our patients are well taken care of. You know, the doctors, without the patient, there is no doctor. Okay. So we are also going to try to work to help to see what we can do, work with the other hospitals, with the JFK, with the Redemption, with other places, to see how we can shorten the time of patient coming to a hospital to see.
Doctor, I'm not cutting you off. So that the LMD is like a advocacy group.
Yes, we are.
Yeah, medical advocacy group. You prioritize the interests of doctors. You also prioritize the interest of, just say the general good of the health sector.
The health sector.
Okay.
That's what we do. Yeah. Okay. So I was coming to that. So And we cannot talk about being treated well and, you know, not extending that treatment also to our patients or others. And we are the only facility. Okay, so also at the facility, patients come there for treatment. When people come to us, it's because they trust us and they know that we can be able to, you know, give back and we can be able to help them out of the situation. So we would like to be in a position too that we will be able to help our patients and make sure that everything goes well. And we also like to tell the public that please don't forget that the doctors, the nurses, the PAs, the nurse aides, they are all humans too. You know, sometimes people think that we are superhumans and yeah, you know, so sometimes it goes that way, but we are also humans too and would like to be, you know, also have that treatment reciprocated to us. So that is our main thing for now. And also, as we talk about the scholarship, there are some areas, key areas of need in the medical society that we know of. And it takes about a year, sometimes 6 months, 18 months or 2 years or so just to do minimum training to get those doctors. Although we would like to do the full training, but as time goes by, we would like to do that and we would like to close up the gap because, as you know, there are a lot of young doctors now as compared to how it was before. And we have them being more passionate to come in to, you know, to do the work and to be able to work for the country and all that. So yeah, so that's why we want to make us more known.
Exactly.
Yes, more bring us to the public and.
Yeah. So do you intend? Do your leadership intend to continue on the outreach, the medical outreach process by your predecessor?
Most definitely.
Okay.
We intend to take LMDA to the people.
Okay.
Yes, we intend to do rotations in counties where we will go and make them, you know, and make our presence feel like you guys are also a part of Liberia. I always tell people that Liberia is not Montserrat or it's not Monrovia.
Sure.
It's the rest of the country. So I like to also.
Okay, thank you very much, Dr. Clark, for that. Details relative to the workings of the LMD. So we come back to the CEO, Dr. Brown. And he's pretty seated here and waiting to answer all of the questions that you will be confronted with. So, Dr. Brown, we are still on the issue of, they said that there are issues of this about patients not paying their medical bills. Yeah, and this is something that have, you know, the John F. Kennedy Medical Center as a government-run institution. They have already been confronted with this. So what about this, Dr. Brown? Is this still going on? And how is that really affecting the workings of the medical center?
Thank you, Creighton. The issue of patients coming at the hospital not paying their bills has been and continue to be a problem. Problem in that if you don't pay your bills, having been discharged or attended to by a physician, you recovered fully. What you do is that, one, you prevent us from taking on other patients that may come in acute emergency and need to be attended to. That is why it's important that having been attended to and you recover and you've been discharged by the physician, it is important that you settle your account or bill with us and free up the bed space. Because if the bed spaces are not free up, then it makes it difficult for us to take another patient in. And that's why we often might say there is no bed. It's not that there is no bed, but you have people occupying the beds and preventing us from taking on other people to have them placed on the bed. And of course, there will be a lot of political outcry to people to place them on the floor as a result of them not paying. So you just have to keep talking with them and possibly see how many of them could possibly settle their account. As we speak, for example, in the maternity center, we have about 18 persons who've been discharged over 2 weeks, and they are still in the hospital with the total bill and around 40 to 100,000 Liberian dollars, and they've not settled it. And if you had other people with acute obstetric condition or emergency coming in, and you told them you don't have space, then it becomes a challenge for them.
Right.
And of course, what makes it more difficult for us is that oftentimes we don't know where to refer patients whenever they show up at our facility, because we feel we should be the last referral
Yeah,
point.
it should be the last referral.
You can't come to JFK and I say, no, go to Redemption or go to Catholic Hospital. No, I should be the last person we should be the last to utter such statement.
Exactly.
But most often we are forced to do so, of course, when you definitely do not have anywhere to place the patient.
Yeah.
Okay, so we want to urge people who people come with a mindset, of course, that it's a government facility, so they should not pay.
Exactly.
And that is saddening, especially when we at times get to realize that some of the people who tend to refuse to pay are people who definitely have the means of paying. Okay, and so it's kind of difficult and challenging
and these fees also are paid by them, by these very same people, to some private institutions.
Oh, definitely.
And then JFK charge way minimum.
That is something
that
that is often shocking. Yeah. Okay, some of the referral comes from institutions where bills where they've been charged exorbitant prices for being there, but on coming to JFK, then they don't have.
I think it is based on the fact that
what's happening is
the mentality that it's a government-run institution.
Yeah, but then,
which, of course, all of the fundings that will be given to the medical center, you also have to go into your operational funding, which you collected from the minimum fees to carry on some projects and things in the medical to upgrade the facility.
Yeah, I
for
agree.
Their own benefit also.
Yeah, I agree that the institution is being subsidized by the government, and we are there to provide service for the people. But at the same time, we ought to provide quality services.
Yeah.
And if we don't have the funding, we will not provide the quality services that you are demanding. Okay, so while we are there working on the infrastructure and showing that we critique the staff to do the right thing and showing that we have the basic emergency drugs available. Of course, if you came and consume all of the medications that we have, and it comes to a point where we don't have funding to replenish the medication, then you've created a problem for another person who is coming for care. Okay, so we really want to appeal to people who are making referral to the facility to see how best you can. I mean, pay toward the bill.
Yeah.
Okay, I mean, if there are some who have paid toward the bill, and once you realize you paid a significant amount, and having asked a couple of questions,
Exactly.
But
because there are some waivers that are done in all about the medical.
There are a lot of waivers done. There are a lot of waivers done on a daily basis, but it's becoming challenging because the number of persons now saying, "Oh, can't pay," and just lying in bed they are kind of increasing in number, and I think this is going to hamper.
Okay, Dr. Brown.
Move on near the hospital.
So because of the sake of time, we just want to take like few callers. So we'll call the numbers and then we'll call in so that you can be able to address some of their concerns. So if you are following the program, this is a reminder that you're listening to Inside JFK on ELBC, and this program comes your way every Monday from 1 o'clock to 1:45 p.m. We have the Chief Executive Officer here today talking about some of the programs, projects, and services offered at the John F. Kennedy Medical Center. And also we have the President-elect of the Liberia Medical and Dental Association, Mrs. Clark. She also here with Mrs. Clark Colley, Dr. Clark Colley. She also here with us. So you can call us on the number 0778-641549 if you wish to participate. 0778-641549, 0778-641549, or 0777-703530, 0777-703530 to be part of the discussion. So we would like to run through it quickly because of the time. Our time is our enemy, and so we like to ask Dr. Brown about, in your continuous effort to upgrade the status of the medical center. There are a series of ongoing renovation works at the Memorial Hospital. So they're on some of those flows and things. So can you speak to the public about some of these projects and how they stand to benefit?
Thank you again, Creighton. Currently, one of our goals is to ensure we have more spaces to put more beds and be able to take on more patients.
Okay.
And so for now, we have a project ongoing on the second floor where we're doing rehabilitation of the surgical ward in collaboration with the Acela Meta, who is partnershiping with us to get the surgical ward to a more ideal standard, so that patient care will be more affordable. We are hoping to have that the first phase of that project completed by mid-November, so that as people get admitted now to the surgical ward, you will see a fairly new ward. I wouldn't say brand new because there is no, we could not replace all of the things there, but I mean, it's going to be a more ideal environment now for patient care on the surgical ward. We have the things project now around 75%, so we soon move on to the front where the thing got collapsed as a result of erosion.
We're coming to that.
Yeah, so by the middle of this month, we hope to get that started, so that we can have the front fence rebuilt.
Okay, you mean at the front?
Yes.
Because the one that already collapsed on the
As a result
20th
of
Street
erosion.
side, it's already
Yes.
been
So,
renovated, and the work is like 85 90% completed. So thank you very much to the management of the John F. Kennedy Medical Center, because that was very disastrous, and it would have really affected some of the people who are around there. So thank you for your far-sighted leadership in trying to construct that site, and in subsequent time, you're going to be coming at the front end of the fence. So that was the other question. So over the weekend, you had breast cancer program. That is the official indoor program to commemorate Breast Cancer Month, which is celebrated every October of each year. And so can you please tell us about, you also mentioned the purchasing or the anticipation by your ministry in the purchase on mammogram machine, in order to help in early diagnosis and all of that. So can you just speak about that quickly?
Yeah, thank you, Creighton. Definitely, we are looking forward to purchasing a mammogram machine, which will help to improve the diagnostic capacity of our surgeons in diagnosing breast lesion or breast cancer at a very early stage.
Yeah, I think we have a caller. Good afternoon, caller. Anymore? Where are you calling from? Welcome to the program Inside JFK. Please move away from your monitor. Good afternoon, caller.
Yeah, good afternoon.
Yeah, good afternoon. Welcome to the program Inside JFK. You call to participate.
Yeah, my name is James Doloyua, and I'll call you from 77 Telegram.
Okay.
Yeah, I want to
Yeah, go ahead, please.
Yeah, I want to gather information concerning the surgery this year, because I heard already that I was starting on the 6th, because I'm spinal surgery, spinal injury, because I was injured 2018 when I fought from a country in Bangladesh.
Okay.
So already I heard the story on this very
Yeah.
on this
Okay.
program.
Okay. So Dr. Brown will provide clarity on that, yeah? Just continue listening. Thank you.
Thank you.
Yeah, Doc, please just conclude and then.
Yeah, so we've been trying to
respond to
do
the caller.
costing on the price. It's around 56,000, and we're thinking how we can get that money. But
Wow.
that's on the easy
So-
way
so-
to get quick. But yes, we will still engage partners to see how we can, because many,
Kind of
some of the
inform
things
us.
we do it in partnership with other friendly non-governmental organization, and at the same time engaging the Ministry of Finance where necessary to get funding. To get those things in place. However, relative the question just asked by one of our callers, let me make something clear before I answer his question. There is no mobile money account that Dr. Brown has for someone to pay money to register to
for
be part
surgery.
of this outreach.
Exactly.
Because someone called me, and then someone had called somebody and said, you need to deposit X amount of dollar to this account to get registered for the coming neurosurgical outreach. in order to be part of it, and the person had to call me to ask whether that was true. That's not true. Okay, any money relating to anything about JFK has to be paid directly
To the
at
founder,
JFK.
yeah, okay.
Yeah, you don't pay money to any Brown mobile money account. Okay, so anyone asking to pay money, make sure it's not. It sure that's not true.
Okay.
We definitely are still going to have the surgery conducted as planned. Whether the elevator gets renovated or not, still we're going to do it. So for if you've not registered, I'd advise you to come and get registered, so that because we're now putting the cases in categories according to the type of physicians that are coming, so that you can definitely form part of the surgery.
Okay, Doc. So just because this, you are the last caller. Good afternoon, caller. Your name, where you calling from? Welcome to the program inside JFK. Please hurry up because we're out of time. Yeah, Aaron. Okay. Okay. Thank you.
Thank you for that question. Right now, best to my knowledge, we are currently conducting our surgery. Okay, and there isn't a plain ophthalmology team yet that I know of, but we currently have the surgeons with the right skills that are currently conducting eye surgery at the facility. So if you have problem with your eye, you can definitely show up, and then we'll get you registered.
Thank you very much, Dr. Jerry Fahnloe Brown, Chief Executive Officer and General Administrator of the John F. Kennedy Medical Center. So for the sake of time, this is how we like to come to an end of this program. But before then, we will take parting comments. Firstly, from Dr. Walter Clark Colley, who is the President-elect of the Liberia Medical and Dental Association. Quickly, Dr. Clark.
Thank you very much. Thank you for having me on your program. And again, we want to reiterate the dates for the sports and for the induction. It's November 26th and November 27th, respectively. We'll be coming to you with more information. So thank you very much for having me.
Thank you very much, Dr. Clark, President-elect Liberia Dental Medical and Dental Association. Quickly, Dr. Brown, your parting comment to the public.
Thank you. We just want everyone to say thanks to everyone for choosing JFK as your site for care. We will do the best we can to meet your needs. We are open to criticism. Because that will help us to change and do the right thing. There are suggestion boxes around at JFK. Please put your suggestion there. We get to read it and see how best we can make the services okay for you. Our dental department is now up and running. So all of you with dental needs, you can definitely come, ranging from putting in denture, replacement, fillings, are all being done now at the dental department. We have not only a dentist there, but also a maxillofacial surgeon. Okay. And we are blessed. We soon be having a GYN consultant who's going to be joining the obstetric department by middle November or early December. I pray we are happy to have an external consultant at the facility. And this is what we try to do as much as possible, bringing in more consulting. We now have one gastroenterologist at the facility. And we try to bring these consultants in so that they work along with our local team to kind of build up the capacity of our local team. But all in all, we continue to do the best we can to provide the best service for people, and of course meet the dream and aspiration of our leader, or His Excellency Dr. Weir, who want to ensure that we curtail referral out of the country as much as possible. But thank you, and keep us in prayer. As I often say, whenever you are at a service and someone wants prayer, you don't have any prayer requests, just say pray for JFK.
Thank you very much. That was the voice of our hard-working, very energetic, and robust CEO of the John F. Kennedy Medical Center, Dr. Jerry Fahnloe Brown. And this is how we'd like to come to an end of today's edition of the program Inside JFK. Please do join us next week for another fascinating and informative edition of the program. I want to say thank you for calling in on the program, and thank you very much. Have yourself a great day. Thank you very much.